Hello, my name is Krista Vermillion with the Vanderbilt University Medical Center, and I'm one of the clinical researchers helping run the Pass-It-On study evaluating convalescent plasma as a treatment for COVID-19. I know this is a difficult time for you and your family. I'd like to talk to you about a research study that is testing whether a new treatment might help patients who are sick with COVID. This study is taking place at hospitals across the country. You may have heard about convalescent plasma in the media. The Food and Drug Administration, or FDA, is now allowing the emergency use of convalescent plasma to treat COVID patients. The FDA also notes that not enough research has been done to know if convalescent plasma is helpful for COVID-19 or not. This research study will try to answer that question. Convalescent plasma comes from patients who have recovered from COVID. These patients have developed antibodies that help fight the virus. When they donate blood, the yellow plasma can be separated out. This plasma can be given to sick patients through their IV line. You are being invited to participate in this study because you have tested positive for COVID and you're in the hospital. The study team will give you a document with important information about this study. It is called an informed consent document. Please read it from beginning to end. If you have any questions, please ask your doctor, nurse, or the study coordinator. I'd like to explain more about the process and timeline of the study. If you decide to join, you will be randomly placed into one of two groups, either the group that receives the plasma treatment or the group that receives a placebo, which is water, salt, and vitamin solution with no plasma in it. The infusion process takes 1 to 3 hours. You will not know if you are receiving the plasma or the fluid with vitamins. Both groups are very important to the study to help researchers find out whether plasma is better or worse than getting no plasma. As part of the study, the researchers will collect information and samples from you to see how you are doing over time. You will give samples of blood at different times, which will total about a tablespoon of blood. Usually these samples can be taken from your IV line. The study team will also review information in your medical record, such as lab results. The study team will follow up with you by phone after you leave the hospital. To compensate you for your time on these calls, you will receive $25 on both day 15 and day 29. It is also important that I mention risks involved. Convalescent plasma has been used in the past to treat other virus infections, so the risk of using it should be small. The study has common risks related to blood draws and transfusions, and other risks that are rare but could be more severe. If the study team sees any severe reactions while you're participating in this study, they will stop the treatment immediately for your protection. A full list of the risks can be found in the written consent form as well as on the screen. There are also potential benefits to taking part in the study, such as faster recovery time or less need for intensive care. Society may benefit as well from learning more about the use of convalescent plasma. The risks and the benefits of the study are listed in the informed consent document you will receive. Protecting your identity and health information is very important to us. Only the research team will have access to your information. If you decide to participate, your information will be protected under a certificate of confidentiality. This means the study team can protect your information and not release it even if requested for legal reasons. This research study is completely voluntary. It is always your choice to take part in a research study. If you choose not to take part in the study, your care and your relationship with your doctors will not be affected. If you choose to participate, you can decide to stop at any time. If you have questions or concerns about participating in the study, please talk with your doctor, nurse, or the study coordinator. Thank you for taking the time to watch this video and to read the informed consent document.